Our next speaker is Lisa Croen. And as you heard, Lisa already introduced herself as a senior research scientist at the Division of Research Kaiser Permanente of Northern California. She's director of the Autism Research Program there and well known to most of the people in the room through her work on epidemiology and many other areas. Welcome.
Thank you. So I'm going to talk, this is a nice companion to the last speaker, a similar kind of study design looking at co-occurring conditions, psychiatric and medical conditions among adults with autism. Just a very quick background, we know children, we're learning today, and many of us know already, children with ASD have increased rates of medical and psychiatric conditions, everything from GI problems to sleep disturbances to seizure, mitochondrial conditions, infection, allergy, asthma, and psychiatric disorders. Children, the rates of autism, the prevalence is going up dramatically. We all know this. The latest figures are 1 in 68. Kids become adults. And so we need to find out what's happening with autistic adults. There's not much information. There have been a few studies, one in particular that was large that Dr. Kohane, I think, will speak about his study that included some adults. Most of the studies in adults have been very limited in size and scope and age group. They focused on the younger adults. So what we did is use the data that are collected routinely as members of Kaiser come in for their routine care. It's a very large data set. The membership in Northern California is about 3.5 million, both kids and adults. And we looked at the health status of adults with an autism diagnosis, autism spectrum disorder diagnosis. This study also looked at healthcare utilization, and we also did a survey of the adult providers, and those last two I won't be speaking about, but maybe in the discussion period I can bring some of that up, because what the providers told us about their knowledge and experience with autism was very critical, I think, to where we need to move the field forward. So I'll be focusing on the health status. Briefly, the study was designed to look at adult members who were 18 or older, who were members of Kaiser Permanente in Northern California for at least 9 months per year over a 5-year period. So this addresses some of the surveillance bias issues that Dr. Jane just mentioned. So we only focused on people who had the same amount of membership, almost full membership over a 5-year period. And we identified adults with an autism spectrum disorder diagnosis. This is based on ICD-9 codes recorded in their medical records. We required at least 2 diagnoses in their medical record anytime through the end of the study period. And we sampled, randomly sampled a control group, a comparison group. These were the same adult members in the same study period who never had an ASD diagnosis recorded in their record. They were matched to the cases on the total length of KPNC membership, sex, and age. So it's a fairly, the opportunity for diagnosis between these two groups we tried to equalize as much as possible. In terms of defining their health status, we looked at all conditions recorded in the electronic medical record in this 5-year period between 2008 and 2012. We used a variety of different strategies to come up with diagnostic categories using, first of all, validated algorithms that used a combination of ICD-9 codes, lab results, and medications that other investigators had developed for specific conditions that they study within our population. So these had been validated against our, with chart review, against using, looking at medical records and comparing to clinical exams. We also have a very large and long-standing cancer registry and diabetes registry. So for those conditions, we linked our study population to those registries to determine cancer and diabetes prevalence. And then for other conditions, we based groupings on this PHEWAS, this Phenome-Wide Association Studies, which essentially takes all of the ICD-9 codes and comes up with a way of grouping them into specific conditions. And then we had, in terms of determining obesity, we used the body mass index that was calculated at each office visit in this 5-year period and took the highest one that had been measured over this 5-year period. We also had self-reported alcohol and smoking. Again, that is asked of each patient when they come in for their care. So this is, do you currently smoke? Do you currently drink? So a little bit about the population. We identified about 1,500 adults with an ASD diagnosis and 10 controls or comparison adults for every case, so it's 15,000. The mean age of this population was about 29, but about a quarter were over 35 and about 10% were over the age of 50. So I think this population is older than other populations that have been reported on in terms of adults with autism. We have a pretty diverse group in terms of race and ethnicity, and about 3/4, 75% were men, and the other 25% were women, which is what we would expect. In terms of the clinical, the phenotype of the autism, about a third, 37% had a diagnosis of autistic disorder, another 30% Asperger's syndrome, and the other third, you couldn't tell from the record. It was a combination, over the course of the many diagnoses, there were both autism and ASD and autistic disorder, so it just wasn't clear what exactly the diagnosis was. And in this population, in terms of intellectual disability, almost 20%, 19% of this population had in there an indication in their medical record of a intellectual disability. Again, I think this is probably an under ascertainment for the reasons that Dr. Jane mentioned. These are medical records, and intellectual disability is often not recorded in these records. So now I'm going to show you a series of bar graphs that look like this, and just to orient everybody to the graph, we have percent along the vertical axis, the y-axis, and a specific condition along the horizontal or x-axis. And so these are basically the rate or the percent or the prevalence of a condition. In the blue bar is in the adults with ASD, and in the red bar it's the comparison group. And the OR is the odds ratio. So in addition to comparing just the straight up percent of these conditions between the case group and the control group, we did a multivariable analysis where we estimated an odds ratio, and this is after adjusting for sex, age, and race ethnicity. So these are adjusted. And so an OR of 3.7 means that the cases were 3.7 times as likely to have an anxiety diagnosis recorded in their medical record as the comparison group, and this is after adjusting for any differences between the two groups of sex and age and race ethnicity. And so what you'll notice as I go through these is that there's a substantial excess or increased rate of almost every condition that we looked at in the autistic adults compared to the comparison adults. This first slide summarizes the individual psychiatric conditions that we looked at. And so there's two take-home messages here. One is that the overall, look at the height of the bars and looking at just the prevalence of the condition is really strikingly high. So, and these again are based on, not based on self-report, but based on medically recorded diagnoses by physicians. So, for example, anxiety was diagnosed in about 29% of the autistic adults versus maybe 8-9% in the non-autistic adults. So 29% anxiety diagnosis, 25-26% depression diagnosis, and you can go on down the line here. Schizophrenia or schizophrenic disorders were 8-9% diagnosed in the autistic group. Obsessive compulsive disorders, 8%. Suicide attempts were on the order of about 3% in the autistic adult population. and this was about a 5-fold higher rate compared to the non-autistic adults. So quite high burden of psychiatric conditions. Interestingly, drug and alcohol use, these are again diagnoses of abuse or dependency, were significantly lower in the autistic group than the comparison group. In terms of some conditions we have seen reported over and over again in children, the same conditions show up as being in excess in adults. Gastrointestinal disorders, and this was a whole slew of different conditions. I just grouped them into one big category here. Nearly 35% of autistic adults were diagnosed with some kind of gastrointestinal disorder in this 5-year period, and it's significantly elevated compared to the controls. Allergy was quite common. Autoimmune diseases were common. Asthma, sleep disorders, we'll hear a lot more about that later, were quite common and almost 2 times as likely to be diagnosed in the autistic adults as the non-autistic adults. And thyroid disease also was significantly elevated. And these are all significantly elevated, the ones I've shown here, statistically significantly. In terms of metabolic conditions, these, and I think this is of special interest for this meeting, because these are most of the data that are published have not addressed obesity. There's a growing body of research on showing obesity is more common in children and adolescents with autism. We find also significantly higher rates of obesity in adults as well. But hypertension, dyslipidemia, diabetes, these are often conditions that occur and are diagnosed later in life, and we don't have much data on this yet. We're finding that, you know, very high rates of these kind of chronic, serious medical conditions that are often precursors to other more serious lifelong conditions. Significantly higher rates in adults with autism. These are other medical conditions that were less common, but again, sort of across the board, across every system, we see significantly increased rates in adults with autism. Okay. And here's neurologic conditions. As expected, epilepsy, seizure disorder was quite a bit more common in the autistic adults. Other disorders of the central nervous system, stroke, Parkinson's, and dementia all occurred much less frequently, but again, significantly elevated in the autistic adults. And again, like the alcohol abuse and dependency, this is the self-reported alcohol and tobacco use, and we see significantly reduced rates of smoking and alcohol in autistic adults, which is very interesting. And we know that these behaviors are often are risk factors for things like hypertension and obesity and some of these other chronic healthcare conditions, and yet these specific behaviors were much less common in the autistic population. So these were the only, of all of the conditions we looked at, these were the only conditions that were significantly less common, commonly diagnosed in the adults with autism. So infection was a little bit less commonly diagnosed, migraine headaches, genitourinary disorders, and cancer. And the cancer finding, I think, is very interesting. I don't know what it means. We had the numbers were very low, so it was hard to really go into this in depth. We did try to look at age at first diagnosis of cancer and stage at first diagnosis of cancer, and there was a little bit of an indication that the stage at which the cancer was first diagnosed was more advanced in the autism group than the non-autism group. But this is, again, is, you know, I take this with a big grain of salt because the numbers were fairly low. But I think this is, in terms of looking further into etiology and what may be shared between autism and non-autism, this might be an area to look at. Am I running out of time, Jerry? Okay, so in summary, there's evidence for increased rates of many of these health conditions. We do know there's some evidence for common biologic causes. There's been some nice genetic work looking at susceptibility, at SNPs and polymorphisms that are similar across several psychiatric disorders, including autism. We know obesity is a risk factor for several chronic conditions, and we see obesity as very high in this population. I think we can say pretty certainly that the communication and social impairments and sensory issues may impede preventive health and early diagnosis and timely treatment, and this would be an area for further research. I think it's clear that nutrition and exercise are very much related to health, and the need for some health education and lifestyle interventions early on in life to make sure that children enter adulthood with good nutrition and exercise regimens to reduce some of these risk factors for chronic illnesses. And then better integration of people with ASD into all aspects of society to reduce the social isolation and discrimination, and which we know the social isolation can be related to many of these diseases, especially anxiety, depression, and the psychiatric problems we see. So these are some research opportunities that I think we have before us, understanding all of the different implications, social, healthcare access, and biologic mechanisms that underlie the increased rates of these medical and psychiatric conditions, and understanding how physicians investigate and manage chronic disease in adults with ASD. And then finally, coming up with some improved strategies for delivering health care to this population is very much needed. And so that's it. Thank you very much.